Welcome to All Things Home Care. This is our first gala. This is our annual gala. We're so happy to be having our honorees here. We are here to celebrate all things home care and the people that really celebrate what we do in home care. So we have a few honorees that we want to celebrate tonight and that we want to say thank you for their work and their workmanship in home care, because without them, home care wouldn't be what it is today. And we are so grateful that people like them care and people like them are willing to give the effort and the acknowledgement to home health care. We are honoring Rona Shapiro from 1199 Union Agency, Linda Paulson from Bel Air Nursing Home, and we also saying thank you to Mildred Gallery, who is of the Caring Majority. Tonight we are raising funds for All Things Home Care because we are in the midst of a crisis in staffing. So we're looking to help support our home care workers with transportation services, education services, promoting the well-being of home health care. So all the funds that we get tonight and the donations that are given to us are going directly to home health care workers and to assist them in transportation services specifically.
Thank you. I'm a Hall of Famer. Yeah.
Well, I was actually introduced to the Caring Majority, and when I first was introduced, we just clicked because we're like-minded. They are fighting for fair pay for home care workers, and I am all for the home care worker that does a job that is not recognized. And so together we're fighting for fair pay for an underserved community.
So I'm hoping that all of you here become a part of the wildfire of home care that we need right now, because we are in a state of emergency.
I started off as a home care worker, and it changed my trajectory of life. It made me want to be a better person. It just changed who I wanted to be. And I stand before you 30 years later doing the same thing, advocating now for people because I can, and I know enough to try to make a change, and I'm not afraid.
But I have to say that if you want to go home, and if you want to go home safely, and if you want to know how to access the community resources out there, Linda is the only person in the industry that knows how to do that job.
When I came to the United States, I went straight to college, and I graduated. I had a bachelor degree in business. I ended up working in Wall Street for about 8 years. Then it was not my core. I went to Delphi University. I have a master from social work. Then I started working in healthcare to helping the geriatric population. It was not long after that when I met with Dana. She's a nurse. I'm a social worker. It became like a great team. To me, the fact that I love what I do, I know it's a whole lot, but I love it. I love doing it. Every morning when I get up to go to work, I'm always happy because I know I can make a change in somebody else's life.
When we fight for fair pay, when we fight for the benefits of the union, when we fight for what's right for our workers, there's nobody else that I would like to fight alongside of than Rona Shapiro.
I've worked for 1199 for the last over 40 years, and I've worked with home care workers, and I am committed to making their lives better. I'm committed to making as many home care workers part of the union as we can, because I think that is the only way that home care workers will have a better life, will have a voice, and will get the recognition and respect that they deserve.
This is a very, very once-in-a-lifetime moment that we are in. There are thousands of elderly people, thousands of disabled people that really will die unless they're able to hire a home care worker. That is just the reality.
Many home care workers have the same problems as their clients do, live in the same communities as their clients do not make enough money to take care of their own families, have to worry about what's going to happen on their way to work, on the subways, on the buses, especially during COVID. And many of the cases are low-hour cases, and so you have to travel maybe 2 hours for a 2 or 3 hour case. And we're committed to not only winning more money for the home care worker, we're committed to making this job a better job. The vulnerable among us need care, and they need people who can concentrate on what they need. And we are trying to expand the scope of what the home care workers do to make their lives better and to make the clients, the consumers' lives better.
And thank you. And if anybody knows home care workers or deals with home care, $11.99, Reliance, let's go.
Well, I don't do it for the recognition, but it is nice just getting appreciated sometime and taking a moment to just think about what you've done and what I still want to accomplish.
We are so grateful for all three of our honorees, and we're so happy to be celebrating them tonight. So if anybody out there is thinking that this is something that they want to help out with or want to donate their time, money, energy to, please call us at 516-308-4840. You can ask for me, Dana, or Randall. We are looking for donations so that we can help support all home care workers out there because they are so well deserving of it.
Today is also about Veterans Day. For years, we've heard about local veterans who, after giving years to our country, are lacking basic necessities and care. I'm sure that you take care of some of them, right? I'd like to invite, in honor of Veterans Day, combat veteran and former Town of Babylon Councilwoman Jacqueline Gordon to the podium.
It is my honor today. I am going to recognize two veterans. They were not able to make it. We're recognizing senior female veterans. So, yes. So I'd like to tell you a little bit about both. So the first person I want to tell you about is Tanya Britt. She was in the military from 1968 to 1991. She had 3 MOSs, so she was a secretary when she first came in, and then she became an admin specialist, and then she finished up in medical supply, and she retired at the rank of Sergeant First Class. Tanya is now 74 years old. She wanted me to tell you that, and she's going to be 75 on May 27th. She is retired. As I said, she loves to travel. This woman, she travels solo, and she takes road trips, like down to the Carolinas. So she is just a phenomenal woman, and all the characteristics she took from the Army is keeping her just strong and healthy and full of life. So that's Tanya Britt. Let's give her a round of applause. Then the next person I would like to introduce you to and to tell you about is Nancy Lieutenant. Nancy Lieutenant is actually my neighbor. She lives in Amityville, I live in Copiague, and the lieutenant name is synonymous with Amityville. Nancy was the first nurse, African-American nurse, in the Army Air Corps, which is like the Air Force before the Air Force was a thing. And she also worked with the Tuskegee Airmen. So she had a full career in the military. She retired, and she came home after retiring, and she worked for 14 years as the nurse at Amityville High School. Nancy celebrated her 100th birthday last year, and I was honored to attend and be invited. And Nancy's now 101 years old. She has all her faculties. She remembers all the stories, and the only reason she's not here is because she goes to bed at 6:30. That's why maybe if we were all in bed at 6:30. So those are the two honorees that I want to recognize tonight, and they're both my friends, and I stand on their shoulders. And I would not be able to have gone as far as I did in the military without them. So thank you so much for hearing their stories.
Next, Sharon Chambers Murphy, Veteran Outreach Program Specialist from the Nassau Vet Center.
So first and foremost, I just want to say thank you for remembering Veterans Day today, and also for taking time out to think about the veterans, the senior veterans, because it is much needed. So I'm so excited to be here to partake in hearing about all things home care, because it could be an additional resource for our veterans to fill the gaps where the VA falls short. So thank you so much for just showing that and speaking about what you're doing. So I am going to actually speak about a Army veteran that she unfortunately could not be here. Her name is Lillian Demby, and she is a senior woman veteran, which we know that women veteran are now up and coming. If you didn't know, we are the fastest growing demographics right now in the Department of Defense. So, yes. So we need our healthcare providers, right, to actually start catering to the needs of our women veterans. More so, right? Education. So Lillian, she served in the Army from 1975 to 1981. I don't have a script, so I don't know how old she is, but I believe she's like 70 plus years old, right? So she is working at the VA. She is about to retire, and she originally came into the VA as a homeless veteran. So where they say that homeless does not exist, that is not true. Homelessness among veterans still does exist. And she currently works in the homeless veteran program at the VA where she was once helped. So she will soon be retiring and reaching out for services, that she may need assistance with. She helps on a daily basis. I remember her coming to my office when she was just under a work program that they had at the VA. She was in a program because of an addiction and homelessness, and so they put them to work, and they got like maybe $5 or $3 or something like that to work, but it was part of their rehabilitation for them to get better. And so with that being said, the program she completed, she finished it, and now she was stuck with, what do I do? She came to my office and said, the program that I'm in, okay, is no longer, it's a contract, whatever. What do you think I should do? Should I apply for this job, which was being a housing specialist? She was afraid to do it. She was afraid to take the chance, and I said, just do it. Just do it. And she did, and she has been in that position longer than I've probably been where I am now. I guess she has been there probably maybe 10 years plus. Right. So she has helped many other veterans that have come behind her that have been homeless as well and that need help. So I'm so happy to be here to honor her in her stead. And I'm so excited about this All Things Care. I can't even tell you really, because I just had a veteran call me, a senior veteran, that I wanted to come, and she said to me, I can't come if someone doesn't drive me because I can't see at night. And that brought tears to my eyes, because transportation, which was mentioned, is a big issue. So we need transportation to get around, whether it's medical appointments or anything, something like this. We need that transportation. She also said, I need help in my house. I live by myself, and she's older. And she said, my dishes, I have a sink full of dishes right now. I have a dishwasher, but I can't put the two together. So I need a little help. So thank you. These are the stories that I hear, but thank you again for honoring veterans, and thank you for having me here this evening.
My name is Christine Pellegrino. I'm a former Assemblywoman. I'm the daughter of aging parents as well. Thank you again so much for being here to help us honor frontline, largely unrecognized workforce of caregivers who do the extraordinary work of keeping homebound individuals safe and able to lead a dignified life. We have sought out partnerships with government agencies such as the Suffolk County Department of Labor, other nonprofits such as the United Way, colleges such as Farmingdale College, and the initiative that we have launched with Farmingdale College is at the precipice of the most creative and I think groundbreaking in this space. We have charted a course to create partnerships with fellow agencies such as Care Connection. We want to thank our partners for their support and their commitment to this issue. Also, our partners in the labor movement. Big thanks to 1199 SEIU. Tremendous work of advocacy for workers in general, for workers in the healthcare space, and for being our partner in this work. We want to thank RWDSU Local 338. They are also frontline workers. They're largely grocery store workers. They saw this fight and came in to support. And we want to thank our friends at IBEW Local 3 for their support of this and our initiatives as well. The labor movement in general has been on the front line of being advocates for the workers in our communities, and we really couldn't be where we are. If you know anything about the landscape of Long Island was not built around public transportation, and so if you live north of Old Country Road or south of Merrick Road, a person has to, sometimes travel 3 hours, take 2 buses, walk a mile in order to be at your door. So grateful to the United Way for giving us, particularly a $10,000 grant in nice bus passes, which we have been giving out in as many as we can, as much as we can, as often as we can, and those have been very well received, and we thank them. More is coming. We have received a $25,000 grant from the Nassau County for transportation reimbursement and education. So I want to thank Nassau County specifically for their investment. This is going to, critical investment in transportation. We want to thank our partners at Investors Bank for their support and for being there for us from the beginning. And we have raised thousands of dollars in direct fundraising, and we want to thank you for all of that. Please make sure you see the raffle table for more.
While we're all here, we are fighting for fair pay for the home care worker. Because as everybody knows, and everybody here has said, that they are valued more than most other skilled services that come in the house. They are everything in home care. Like Dana said, without the home care worker, there would be no home care. So with that being said, I want to invite Julia up here so that everybody, if you can just take out your phones so that we can instruct you on how you can do your part for the home care worker.
You can go to the website to sign the petition to the governor of New York to pass fair pay for home care. And so please go and sign that petition. And I just have to give another plug because there's also right now $150 billion on the line for home care at the federal level in the Build Back Better Act.
Let's get that money.
We need to get that money.
Yes.
Let it go to the right people.
And we need to make sure it goes to home care workers. And so
First, I want to thank God for everything. It's a blessing. I also want to say thank you to all thing members, all home care, because I know they work so hard to make things happen. So thank you to all of you guys. Also, I have to say that would not be fair for me not to mention, to say thank you to my loving husband, Sel. To my son, Greg, my daughter, Tanya, all my extended family, they know who they are, and my colleagues, my friends, my Bel Air family, my team from Bel Air. So thank you. Thank you to all of you. Thank you to all of you for believing me, because without you, thank you for joining me on this unforgettable journey. God bless you all. I love you all. Thank you.
The majority of our members, we have almost 60,000 members throughout the state, they are older women of color. Their average age of home care workers in 1199 is 57. It went up from 55 to 57. We, in 1199, we're fighting for the BBBB, because without that, without the $150 million, people will go without care, because home care workers are not going to keep working, risking their own lives, their own family lives for pennies. They could love their job, they could love their clients, but they love their families, and they need to protect themselves. So we have an opportunity with President Biden. He's the first president who actually talks about home care workers. This is like, I've been in this fight for 40 years, and when Dana said the governor didn't thank home care workers, the mayor didn't thank home care workers in New York, I don't know what they did in Long Island, they probably didn't thank them either. And the home care workers are like, what the hell? We were the ones traveling. You were in your house on remote. You were in your house on your computer. We're the ones who left our homes to care. They are the heroes. And so we're trying to win the money, and then we got to come back to New York State and make sure the legislators in New York State take that money and give it to workers. But we're also trying to make a home care job a middle-class job. Why would anybody in Long Island? And I'm sorry, I live in Yonkers. I don't know how many of you live in Long Island, but you need to start electing people who are going to fight for home care workers and working people. Because the reason why home care workers in Long Island make $12.50 is because your electeds did not stand up for working home care workers. So it is up to us, and we are going to fight like freaking hell. I would curse, but I don't know you all that well. But we are fighting. We are fighting like hell. And there, the point that Julia made, and Caring Majority is doing so much. We're going to Washington. We're taking home care workers on Monday and Tuesday. We're taking consumers to Washington, SEIU, 1199, 500 workers to say, you know what, is enough.
Well, that's all the time we have for this episode of All Things Home Care with Dana Arnone. If you want to know more about the topics we covered today, or someone you know needs assistance, you can find numbers, links, and watch all of our episodes on our website, allthingshomecare.org. Follow us on Facebook and Instagram. And please always remember, there is no one more essential than those who come to care for us in our home. See you next time.
All Things Home Care elevates and supports home health caregivers by providing transportation and promoting education to better care for homebound seniors and the disabled. To find out more or to make a donation, visit us at allthingshomecare.org.